Hello, I am Dr. Madhusudan. I am a vitreoretinal surgeon at Trinity Super Specialty Eye Hospital at Coimbatore. Today, I would like to discuss with you the importance of eye screening in a diabetic patient. As you are aware that the WHO study, the World Health Organization study has said that India is the diabetic capital of the world. We have more than 100 million people who are diabetic, out of which at least about more than 20 million people have some form of diabetic eye disease affecting the eye with some amount of visual loss, out of which 2.5 million people have already lost their vision because of diabetes. So today my talk is just basically a message in which the importance of having a regular diabetic eye screening in all patients who are diabetics. I would like to just show you a few examples. This is a particular patient who is a diabetic for the past 5 to 6 years. You can see that this is the normal retina, the fundus, and you are finding this hard exudates which are present. So this indicates that the patient has diabetic eye disease affecting, and this is a patient who is a diabetic for 5 to 6 years. This patient will probably have about 1 line decrease in vision. Similarly, the other eye of the patient also has been affected with, we call it clinically significant macular edema. So a single look at the patient will indicate to us that the patient has been having diabetes for a number of years. We sometimes have patients who come to us who are not aware that they are diabetic, but they come to us for a regular eye checkup or for a change of glasses. And once we dilate and have a look at their fundus, we are able to find out that they already have diabetic eye disease, and hence we refer them to a diabetologist. Now, this is a patient who has been having diabetes for the past 8 to 10 years, and they present to us with sudden decrease in vision. You can see that the patient has developed a bleed, which has affected the central part of the eye. So, and this is another patient who has developed a diabetic, we call it an advanced diabetic eye disease or a proliferative diabetic retinopathy, in which the patient has got vitreous hemorrhage. Now, this particular patient has got a tractional component. That is, the patient is a long-standing diabetic, more than 10 years, and he has developed a tractional retinal detachment, and that is causing lifting of the macula because of traction, and therefore he has got decreased vision. This is another patient who has come who is an insulin-dependent diabetic who has got an advanced diabetic eye disease which requires a surgical management. Now, this particular patient has come with a total loss of vision because of a total bleed within the eye. So, these are some of the examples of the patients who present to us in our diabetic eye clinic on a regular basis. So, we would like to ensure that the message which goes across is that if you are a diabetic, you should get your eye checked at least once a year. You have been regularly going to a diabetologist for sugar control. You are also checking your BP and ECG, etc., but you forget to get an eye checked. Help prevent diabetic blindness. If you are a diabetic, get your eyes checked. Thank you.